Welcome to the Los Angeles Sentinel Daily Brief. This is where we bring you the headlines that are impacting the Black experience. I'm Niele Anderson, and here's what you need to know for today. There's a huge conversation locally, statewide, and nationally about tobacco products in the African American community. Here in California, Prop 31 was just passed in November, and we're going to have a conversation with Carol McGruder, co-chair of the African American Tobacco Control Leadership Council, to talk about what's happening in California and on a national level when we talk about tobacco, menthol, and African Americans. So you're in Los Angeles. Can you talk to us about why you're here in LA?
Well, I'm here in LA because we came down to meet with our new Madam Mayor, Karen Bass, on Saturday, myself and the other co-chair, Dr. Philip Gardner, and Dr. Valerie Yerger, who's our third unofficial co-chair.
Okay.
And Madam Mayor Bass has been standing with us since she was the Speaker of the Assembly and went on to become chair of the Congressional Black Caucus. And so we were enthused that she's here at this time, at this moment, because it's a very exciting time for African Americans and commercial tobacco control in terms of really making some headway to get the deadliest killer of Black people off the market once and for all.
Can you take a deeper dive into the impact of menthol cigarettes on African Americans?
I would love to. So menthol, 80%, 90% of Black smokers who smoke a mentholated tobacco product. And that's led some people to mistakenly believe that menthol is part of our culture, that it's part of our community. And the reason for that such a high percentage of Black people smoke mentholated products is because these products were dumped in our communities when I was a teenager in the 60s and 70s and seeded. Menthol cigarettes, like Dave Chappelle was given free cigarettes when he was 14 in Washington, D.C. at the Metro. A young woman who was given cigarettes when she was 9 years old, who, if she were alive, she would be my age in Boston. So that's the fight, and that's the reason why getting these products are so critical to our health. So 45,000 Black people die every year from tobacco-induced diseases, and that's more than everything else combined.
So you say everything else combined. You're talking about like cancer,
I'm talking about
HIV,
homicides, HIV, AIDS, car accidents, all the cancers that are non-tobacco related, breast cancer, prostate cancer, bladder cancer, pancreatic cancer. All of these can be caused by different reasons, and one of those reasons could be tobacco.
And so the council's mission is to totally ban menthol.
Our mission is to save the lives of the 45,000 Black people who die from tobacco-induced diseases every year in this country.
And how do you do that?
Well, you take those products off the market.
So we're talking about a ban.
We're talking about a ban. And we've been working on that locally. We're California-based, but this is a national issue. We've actually sued the FDA. So people, when people are like, well, why are you taking our cigarettes off? So those were left on. Right. The other flavored tobacco products were taken off the market when President Barack Obama, we can remember him, signed the Tobacco Control Act in 2009. Because of leaders, Karen Bass wasn't in Congress then, but there was another woman, Donna Christensen, who was a medical doctor, the representative for the Virgin Islands. So there was an amendment put on the Tobacco Control Act at the behest of the Congressional Black Caucus that charged the FDA to do something about menthol. If we hadn't had that amendment, then probably nothing would have been done because they wouldn't have had the legal requirement to do something. So then in 2009, they began to study, they began to make decisions, but they never acted on them because there's so much political interference and there's so much money on the table with the tobacco industry cartel that they managed to block everything. So we sued them along with the Action on Smoking Our Health, with the American Medical Association, which is our white doctors, and the National Medical Association, which is our Black doctors. We're actually co-plaintiffs with us with the FDA. And nationally, these products are supposed to come off the market this year in August. But we know that we have such gridlock on the federal level. We know that nothing moves. And that's why cities and states have the authority to do certain things. And they need to do those things to protect their people right now. And
which brings you to LA.
Which brings me to LA.
To talk to Mayor Bass.
Yes.
Now, this conversation is very controversial within the Black community.
It is, yes.
Some say with the ban, you'll have more situations like what happened to Eric Garner at the store in New York.
Yes.
And we know that made national headlines.
Yes.
What's your response to the pushback from the community? I'm talking about organizations like the National Action Network.
Yes.
Black leaders are some pastors
Yes.
are pushing
Yes.
back on this conversation.
Yes.
What's your response to that?
My response to that is that most of the people who are pushing back receive money from the tobacco industry. So you have to follow the money. So we have people, Al Sharpton, who's a champion for our community, who's fought, now everybody wants to talk to Al Sharpton, but there was a time when people didn't, he wasn't getting their respect, but he still takes money from Reynolds American Tobacco, which is Newport Cigarettes. And so we want to have that conversation, but without people who are taking money from the number one killer of Black people. They don't merit a seat at that table. But our position is that we can't wait and let the biggest killer, the biggest wolf, roam around quietly in our community while we're crying and grieving over the loss of our Black men who are dying on camera. And so we're seeing it graphically. And that is a visceral gut reaction that we have as a community. And that we have to do something about that.
The marketing for menthol cigarettes versus Marlboro.
Yes.
So Marlboro is not a menthol cigarette, right?
There are mentholated Marlboro cigarettes, but the mentholated products, which ones that are really ingrained in our communities, of course, are Newports, Cools, and Salems. But the marketing, the tobacco industry markets to everybody. That's their specialty. But what they did to our community was they came in and they really manipulated and co-opted our culture. And I met a woman, just ironically, in Cuba who used to do the Coca-Cola advertising. So she would come behind these tobacco executives who designed the media in the 70s. And those were white people who were defining what Blackness is, what coolness is, what the revolution is, and turning that around to market a deadly product to us that's addictive and that self-populates. Once you get addiction going, you get a community norm, then it just, it grows like weeds. And so that is that pernicious marketing. And the criminals are the tobacco companies because they are federally adjudicated racketeers. And we have borne the brunt of their mafioso racketeering. We have borne the brunt of that targeting and the inattention by the public health agencies that are supposed to protect us, which would be the FDA, and that's why we sued them.
Right.
And so we are working on all levels, and so we need to work on demand and supply.
I just want to talk a little bit about Prop 31 and just talk about what that implies because it just passed on the ballot in November.
Right. So Prop 31 was a proposition, it was a referendum put on the ballot by the tobacco industry cartel after Senate Bill 793 had been passed bipartisan vote. Newsom had signed it. That would have taken effect in June of 2020. So that was voted in. The industry collects signatures. So now that's delayed 2 more years. So every year of delay is another generation. It's another addicted group of folks who might not have been that way if we were able to do something about this. So Prop 31 passed in November, and now California is in the process, at the second state after Massachusetts, of taking these products off the shelf. This is about retailers, and the fine is $250 for retailers, and it's about interrupting.
Seems like it should be a little higher.
It should be a little bit higher. It should be a little bit higher, but we get things, and then
$250 a parking ticket could be $500.
Exactly. But if they get several citations, then they get their license pulled. So the big thing is to get them to stop doing it, and then they have to have a tobacco license. They won't be able to sell any products. So that builds up.
And we're talking about blunt papers, tobacco rolling papers, cigarettes.
Flavored tobacco products. So Black and Mild, Swisher Sweets Backwoods, the flavored cigarettes, and flavored vaping products as well. So hookah got an exemption. We didn't want that.
Does hookah have tobacco in it?
It does. It does. And hookah is not good. Hookah is not good. People think of it as a less harmful alternative, but it is not. It has its own inherent problems, and we're going to get with hookah.
We're going to get with hookah.
But right now we're trying to get with our people and save our people first.
Okay, so before we let you go, what resources are available once you snatch these products off the street?
So we want our community to know that we are here to support each other. We do this for our Black smokers, even though they might feel under siege, and that there are tons of resources now. So the state has resources. People need to call 800-300-8086, and that you will get a counselor who will walk you through this. There's also kickitca.org. You can, for people who want to just get online. And we also have, through our African American Statewide Coordinating Center, which the website is amplify.love. We have here in LA, actually, Dr. Karen Beard, who's heading up our efforts to really put quitting smoking in the context of our lives, which has to do with a lot of extra stress, racism, social determinants of health. So we're tailoring programs for people. Whatever you get, you can get it how you want it. And that's part of what AATCLC does, and our website is savingblacklives.org, is we are on all different aspects of commercial tobacco control. We are in this, we are leaders of this movement, and we are going to make sure that our people are getting the services that they need, that we pull together. People can quit, and people can have health. We can have vibrant and healthy Black communities, and that's what this is about, the big picture.
You know what amazes me? That from this conversation, I feel like marijuana is safer than tobacco.
In terms of your health?
Yeah, in terms of your health. And marijuana was used to disenfranchise and lock up so many people of color, yet white people were able to legalize something that is killing us. It just gives you something to think about.
It gives you something to think about.
It really does. But nevertheless, kickitca.org. Thank you so much.
Thank you so much.
All right. And for the latest in Black news, you want to head over to lasentinel.net. I'm Niele Anderson, and you have just been debriefed.